Okay. Well, it's great to be here to talk about this critical problem in America. The numbers are just stunning. CDC says the better part of 100,000 deaths a year, the vast majority from opioids in overdose cases. What is happening? Is it getting better or worse, Kellyanne?
Well, thank you, CPAC, for having me again. And I'm really glad, I'm very happy that CPAC is shining a light on this issue. The president declared a public health emergency in the first year in office. The president and the first lady both work on this public policy crisis. We call it the crisis next door because it is indiscriminate. The opioid and drug supply, drug demand crisis does not discriminate by race, by age, by gender, by socioeconomic status, by geography. It literally is in every nook and cranny in this country. As harrowing as the numbers are, the good news is the focus on more interdiction and surveillance, the focus on more access to treatment and recovery, the focus and the money that's now being given to all of those and education and prevention is starting to bend the curve in the right direction. Quickly, I'll tell you that H.R. 6 was a piece of legislation passed last year. It passed in the Senate 98-1. Every single Democratic senator running for president in 2020, albeit unsuccessfully, voted for that legislation. And I want you to remember that when they tell you that we don't need a wall at the southern border, we don't need more resources for drug interdiction, they're already on record with their vote as saying that we have a drug crisis in this country, and they voted for a whole bunch of measures, prevention, education, treatment, recovery, interdiction, surveillance, in H.R. 6. CPB and ICE have interdicted historic amounts of fentanyl. Fentanyl is an instant killer, and a tiny little grain of it can wipe us out. Little grain, and it's being laced into marijuana, heroin, meth, cocaine, and street drugs. And I want to tell the youth out there watching and here in the hall, this is not just something you can do and before. You can save a life. You can help destigmatize, break through the silence and the stigma. You're worth more than taking some street pill. You have no idea what the source of that pill is. You have no idea if it's increasingly laced with fentanyl, synthetic opioid being mainly manufactured in China and being brought into this country through different ports of entry, through our mails, and yes, illegally as well. But ICE, those who want to abolish ICE would be giving up the 2,200 pounds of fentanyl that they interdicted over the last several years alone. And my hat's off to the brave men and women at Customs and Border Patrol and ICE for keeping us all safe with the drug crisis. Thank you.
Well, Sara, Kellyanne brought up the border aspect of the opioid crisis. This is something you know a lot about. What do you think is some of the most important things being done at the border?
Well, right now, just the attention that we've been drawing to the border crisis is incredible. I think the administration, for the first time in my career, and I've spent the majority of my career, especially the very beginnings of my career, covering the U.S. southern border. Yeah, you know, probably all the way going back to the Daily Bulletin in California, where I can tell you this crisis has been going on for decades. This is a national emergency. Our children are dying. Our children are dying. Their parents are dying. Mothers are dying. Babies are being born exposed to drugs. And it's the worst crisis we've ever seen. I'm listening to Kellyanne and I'm thinking, for the first time, and I say this over and over again, Kellyanne, and I know you've got the world on your shoulders because you have focused so much on the opioid crisis and you've done so much incredible work to draw attention to that. But it's sometimes, it doesn't even feel like enough. I mean, it's so big out there. I mean, I have parents who say to me, Sara, I had no idea that there were drugs on the street that look just like Xanax, look just like Percocet, but they're actually fentanyl heroin. Our kids are having parties, and they call them Skittles parties, where they bring pills and put them into bowls. And everybody just kind of picks whatever pill they want and they take them. I mean, it's kind of a shocking thing when I heard about this, just randomly taking pills. And some of these children, unbeknownst to them, are taking a Xanax that's actually a contraband Xanax, and they're dying immediately. There is no chance to save their life. They don't make it to the hospital. It was one mistake, one time, and their lives are lost. I really think we need public service announcements. I think kids need to be told what's going on. I don't think there's enough attention to that. Please, I think this is probably one of the most important things and most important crisis of our time. I have spent so much time on the US-Mexico border. I can tell you how porous it is. I remember when I first began covering the border, probably back in 2004, 2003, and Border Patrol agents, Immigration and Customs Enforcement, they would tell me over and over again, it's like theater. Nobody's listening to us, not even in the administration. They'll put me out on a spot, and I would go out there with them. And I'm sitting here all alone, and I can't even call for backup. And I can hear and see people coming across the border or sensors going off. And at one point, believe me, Border Patrol agents, they stopped chasing them. This was a while back. They said, I can't do it because I put my life on the line and then I get charged with something if there's an altercation.
Yep.
When is somebody going to do something about it? And I think we're seeing this administration doing this right now.
Kellyanne, what are the most important tools for the administration to use on the demand and supply side?
Thank you, Sara, for giving us that aspect. I know you've been doing, I don't know if the audience realizes how much work you've been doing on this crisis for a very long time at the border and elsewise. So a few things. I don't know if we have the ad queued up, but we brought a couple of the ads that have been running and continue to run that have been sponsored in partnership with some outside groups. These are public service announcements to really bring home. Do we have it? I don't know if we have it.
I'm not sure.
Well, we do have it. I don't know if they have time to show it. But opioid crisis, maybe we can actually share it with CPAC members in a different way. But they've been running, they've got millions and millions of impressions actually. And we're really focused on the 18 to 24-year-olds with the halo audiences of 15 to 30-year-olds. But as I said before, this crisis is indiscriminate by age as well. And what's tricky about opioids is very simple. It's legally prescribed. So that tiny little bottle can be deceptive. It bears the label of the family doctor and the local pharmacy. And it was legally prescribed to help someone manage his or her pain. The issue is the overprescription. And I'm happy to say that under the president's leadership, in concert with many different governors and other state health officials, and the whole of government approach in his administration, much of the overprescription is starting to melt away because whether it's through guilt, professional responsibility, fear of liability, more information, whatever the combination is, it's working because we're getting fewer pills into the supply chain. Number two, there's something called National Take Back Day. It's gone on for about 8.5 years. And it's the last Saturday in April, so it's coming up, and the last Saturday in October. This is important because it's the day when you can bring your unused, expired, unneeded drugs to police stations, local pharmacies, many other places. One thing we're doing in the administration is we're trying to make every day Take Back Day. So you don't have to have the pills sitting around for 6 months until the next Take Back Day. Many community pharmacists, many chain pharmacies, certainly our National Safety Council provides ways to the public to dispose of these drugs safely and legally before, in between the take-back days. The First Lady has really brought great attention to an issue that Sara just touched upon that I would like to amplify for a moment. The First Lady, Mrs. Melania Trump, is very committed to the NAS babies, neonatal abstinence syndrome. 1 in 100 babies born every day in this country are already exposed or chemically dependent on some type of drug or substance. That's 150 babies each day struggling to take their first breaths. And since we already have the most pro-life president in American history, just thought I'd get that in there. This is a natural extension of that, is trying to help those newborns. There is more additional funding and additional awareness in the legislation that I talked about before that the Democrats all voted for in the House and the Senate. Every single Democrat that voted, and every single Democratic senator did vote, voted for that legislation, and I don't want you to forget it. The other tools that are important is for people to understand pain management need not always mean pain medication, and that we're not talking about the millions and millions of Americans, my own mother included, hi Mom, who rely upon pain medication to get through their daily lives. That's chronic pain medication. We're talking opioids are really meant to be temporary pain relief for the collegiate or high school athlete injury, for the dental procedure. Many of the opioids prescribed to youth are prescribed because of dental procedures and for routine surgeries. We're talking about the management of temporary pain. And so what people need to do is, we're all told, know your own body, you have the right, you do have the right to say no to overprescribing. When your pain is managed, you can bring those drugs somewhere else. But I want to tell you the really great news. We don't believe that treatment and recovery stops in the doctor's office or in the treatment center. We're trying a whole of government approach to treat the whole person. So the displaced worker grant program, for example, things that we're doing with Department of Labor, the Envision Centers at HUD, private companies like, I think Mike Lindell from My Pillow is here. He set up a Lindell Recovery Center in Minnesota. Thank you, Mike. Belden Industries in Indiana. If you fail a drug test, instead of losing your job, which means you lose the pathway to recovery for many people also, instead of losing your job, Belden Industries and other employers like them will let you keep that job, but you must immediately enter a treatment program. And they're working with local community colleges, and they're working with the local health professionals. Unshattered is a nonprofit that helps women get back on their feet and helps to employ them, connect them with educational employment opportunities. So we're trying to treat the whole person. And frankly, the issue has just been ignored for many, many years, and we're not going to turn a blind eye to it. It's truly the equivalent of an airplane falling from the sky every day in American deaths. I want you to think about that, because if an airplane was falling from the sky every single day, we would all stop and say, why are the airplanes falling from the sky? So essentially, the president is saying, pay attention to it that way. Join me, he is saying, in doing each of our individual small part in combating the single worst drug crisis in American history.
And I want to just buttress right off of that, because Kellyanne's right. And when you talk to parents who've lost their children, I say, what is one of the biggest lessons you've learned? And they say, take away the shame.
Yes.
It is our responsibility to face this, because if we're too ashamed to face the truth, too ashamed to listen to our children and to listen to our family members, then the drug cartels are going to win, right? Because they are moving these narcotics in. This is not just about the pharma industry, although, there's bear a lot of responsibility on overprescription, and we've heard that before. But what about the drug cartels? Sinaloa, Juarez, the China market, the Russian market of fentanyl, and the movement of these narcotics into the United States. We have to say no more. You are not allowed to poison our kids. You can try. But we are going to fight you every single day. We are not going to allow you to do this. We are going to back up policies that will change this. And, and then things will change. If we choose to ignore what's happening to our country, we are going to lose a generation of children. I can tell you that. I've never seen anything quite like this than when I went to the epicenter in Ohio and other states who are facing this crisis, where the morgues were so overflowing with bodies that they had to rent freezer trailers to put the children in the freezer trailers outside of the mortuary. I never saw anything like this. I never saw the way people cried and begged and pleaded for someone to just pay attention. And even those that are working undercover in the DEA, in places like Ohio. I mean, Ohio, for crying out loud, middle America, and they're saying it's being divided up by the drug cartels. I mean, the drug cartels own territory in our own country. So think about that, and think about what this crisis is doing, and think about what this administration is doing, because for the first time, we're actually seeing an administration that cares enough to do something about it and not just ignore it.
With Kellyanne, there are people, no doubt, in this room at this moment who are facing this crisis in their own families. What would you say to them?
Well, first, you're not alone. We see you, we hear you, and we're with you. And the we is really the whole of government approach across the federal government horizontally, but more importantly, it's the vertical approach. It's the federal, state, and local, and we don't substitute our judgment for what the healthcare providers locally, law enforcement, and the families believe is the best way to combat this crisis. The best thing you can do is break through the stigma and the silence and let people know, learn how to detect the misuse and the overuse and the abuse. And also, I think, to really raise awareness, because we've done a masterful job in this country raising awareness against drunk driving, for example, or about different types of cancer. We've raised awareness, we've raised money for that, heart disease, thank God. But this is a bigger killer now than cancer, than breast cancer, than accidents, than gun violence, all these different problems that we have, killers that we have been able to raise awareness about. And so for me, I think that number one thing to do is to make sure people know 2 words in our everyday lexicon, and the president has been on the front lines of doing this himself. One word is fentanyl, F-E-N-T-A-N-Y-L. And so I do talk about not biased coverage, because that's easy to see if you want, but incomplete coverage. If this country doesn't know what fentanyl is, then lots of folks are falling down on the job and not giving you the news you can actually use, information relevant to you. Chinese fentanyl. Fentanyl is an instant killer. It's the grain I talked about. It's what Sara and others are speaking about also. But that is, 28 states have seen a massive increase in death by synthetic opioids, which includes fentanyl. And it's insidious and it's lethal. Number 2, Narcan or naloxone. The Surgeon General issued his first advisory in 13 years, and it was about making sure that naloxone is with all of us, that we know how to use naloxone. Naloxone is an overdose reversing drug, very easy to use. We're getting it increasingly in our schools, at our YMCAs, at our libraries, places where the public is traversing, and God forbid if Sara is overdosing, any of us can take that and help reverse that overdose. It's literally saving lives. You can save a life. And finally, to understand that in dozens and dozens, most states, over 30 states or so, have the Good Samaritan law. So if somebody is overdosing, you can drive that individual, no questions asked, no liability to you. And that's saving lives, because in the past, people would just open up the car door and fire up the engine away, and the bluing corpse would roll out near the emergency room door. Now you can go to a fire station, a police station, a hospital, and that is literally saving lives. You know, in many of the fire stations across this country, those fire stations are 2, 3, 4 times more likely to receive a call to respond to a drug overdose than a fire.
Yeah.
So they have been learning how to help administer care, life-saving care, and do that warm handoff to health professionals. There's so much you can do in your own community, and it really begins with each of us. I think since it's the crisis next door, the solutions are next door as well. Thank you for that.
Yeah, this is a crisis that we are all dealing with. Every one of our families. Kellyanne's right. Every friend, I'm sure we all know someone or know somebody in our neighborhood or somebody in our family that's dealing with this. I wanted to add something to that. We did a nonprofit film. I did a nonprofit film last year called Not in Vain. You can see it at notinvainusa.com. If you want to learn more about this crisis and be able to connect with the people who have been affected by it. I think this is so important. This is a top priority for this administration, and it has to be. And I know they're holding themselves accountable for it because they're doing everything they can. But this is a top priority for each one of us as Americans if we want to save our country and we want to stop the poison that's flowing in and killing our citizens and our children. And we should not allow it to happen. And remember, look at this as this is an attack. This is an attack on your kids, and every time they go to school, into middle school, there's somebody there trying to recruit them. They're children. They don't always make the right decisions. We have to guide them. We have to teach them, and we have to be there to watch over them as a nation and as parents. So please do that, please.
Well, thank you, Sara. That's a great last word, and everyone should definitely see the film Not in Vain. I want to thank Kellyanne and Sara for all that you're doing on this critical crisis. Thanks.
Thank you.